Lucky Land Casino, asking people, what's the weirdest place you've gotten lucky?
Lucky? In line at the deli, I guess?
Aha, in my dentist's office. More than once, actually.
Do I have to say?
Yes, you do.
In the car before my kids' PTA meeting.
Really?
Yes.
Excuse me, what's the weirdest place you've gotten lucky?
I never win and tell.
Well, there you have it. You can get lucky anywhere, playing at LuckyLandSlots.com. Play for free right now. Are you feeling lucky? No purchase necessary. Void where prohibited by law. 18 plus. Terms and conditions apply. See website for details.
Hey all, welcome back to the Real Life Pharmacology podcast. I'm your host, pharmacist Eric Christensen. Thank you so much for listening today. As always, go check out reallifepharmacology.com. Grab your free 31-page PDF on the top 200 drugs. Great little study guide, refresher for board exams, or if you're just looking to get up to speed with practice, or if you're in school taking pharmacology exams, finals, things like that. Good little refresher with lots of real-life pearls and things that matter with each of the top 200 drugs there. So again, reallifepharmacology.com. Go snag that free PDF. All right, so let's get into the drug today, and it's not really a drug, I guess. It's more of a supplement, and that is folic acid. But it definitely plays a role in medication therapy, particularly when we use specific drugs, which I'll discuss. It definitely plays a role there for sure. A little bit about folic acid, water-soluble vitamin. So typically accumulation isn't a big deal in most situations. Compare that to some of the fat-soluble vitamins where excessive supplementation could potentially lead to more accumulation there. Mechanistically, folic acid plays a role in forming coenzymes and metabolic reactions and processes, DNA production, and red blood cell production, which, folic acid, if you're looking at deficiencies in clinical practice, one of the most important things that we're going to look out for is potentially anemia. And again, that goes back to, folic acid being important with red blood cell production. Other uses, prevention of neural tube defects in females of childbearing age. So that's certainly a use and a reason for supplementation that I've seen actually in clinical practice. Certain medications, I'll get into that a little bit. Just a couple off the top of my head. Methotrexate. Folic acid supplementation is always recommended with that medication, or typically recommended. Phenytoin can cause some gingival hyperplasia, and folic acid supplementation can help potentially reduce the risk of that adverse effect. Going back to kind of methotrexate, remember methotrexate is technically classified as an agent that's used as an oncology agent, as well as a medication used in the management of autoimmune diseases like rheumatoid arthritis, for example. It's an anti-metabolite, and it ultimately reduces folate within the intracellular folate within the body there. Other situations where you might see folic acid supplementation, alcoholic patients, you often see a vitamin cocktail there of B12 and thiamine and potentially things like magnesium. Again, kind of depends upon what issues that patient is having, and obviously how severe the alcohol use disorder is. And then potentially issues with GI absorption, so bariatric surgery, certain types of gastrointestinal diseases where malabsorption may play a role. That's another situation where you might see folic acid supplemented. Adverse drug reactions, typically the dosing you're going to see is 1 to 5 milligrams. 95 to 100% of the time, in patients taking, folic acid, let's say for methotrexate purposes, the most often dose I've seen is 1 milligram. Adverse drug reactions, potentially could go up, or the risk for them could go up as you increase that dose. But overall, in general, I see very, very few issues with kind of your standard supplementation of folic acid. So things to keep in mind, flushing, hypersensitivity, again, extremely, extremely rare that they're going to cause any significant issues, but just a couple that I'll throw out there. I mentioned, kind of alluded to that dosing a little bit for supplementation, and again, 1 milligram is definitely the dose I see most often when using for, kind of just general supplementation purposes. With folic acid, obviously, it's found in food, and we get it through our diet, and the recommended dietary allowance or intake is 200 micrograms per day. So again, that's about 0.2 milligrams, where the supplement typically at 1 milligram is going to be 5 times the recommended dietary allowance there. So that just gives you a little ballpark on dosing, dietary intake versus supplementation, because most people, if they don't have a reason to take folic acid and they're eating a relatively normal diet, certainly aren't going to need folic acid in most situations. Drug levels, I did want to mention specifically, or serum levels, I should say, not necessarily drug levels, but so serum levels, ballpark range 2 to 20 is kind of what I remember from most labs. I have seen a little bit higher, like 3 to 18 or 2 to 16, a little lower upper end. So that can kind of range a little bit based upon the lab you're looking at. So it's important when we're looking at those blood levels to understand the lab it's coming from too, but that kind of gives you a ballpark. So again, probably in that 2 to 20 nanograms per mil. That's the most common normal level that I see there. Megaloblastic anemia, I did want to mention, folic acid deficiency certainly can cause this, but it's also really, really important that B12 deficiency is assessed as well in patients with megaloblastic anemia. This is, again, patients with a higher mean corpuscular volume, or MCV. That may be indicative of a folate or B12 deficiency causing anemia. So really, really important to assess B12 along with folate deficiency in dealing with our patients with anemia there. All right, let's take a quick break from our sponsor, and we'll wrap up with drug interactions. If you're in the market for pharmacist board certification study material, like pharmacotherapy exam, geriatrics exam, ambulatory care, MTM, the NAPLEX exam, definitely go check out all our resources at meded101.com/store. In addition, if you're another healthcare professional, we've got books on drug interactions, case studies, drug-food interactions, lots of unique resources that can really help round out your education as a clinician and or fellow healthcare professional. So again, support there helps keep this podcast free. So again, all the links there you can find meded101.com/store, STORE. All right, so wrapping up with drug interactions, as we usually do here, whenever I see folic acid, or whenever I see some of these medications, I think about the potential need to supplement folic acid. So here's a few medications that I've definitely come across that could potentially lead to folic acid deficiency. So phenytoin, we kind of mentioned before, definitely keep an eye out for that one. Methotrexate, definitely mentioned that before. Some other unique ones, trimethoprim, again used for UTIs, sometimes UTI prophylaxis. And trimethoprim is probably not one I'm going to worry about if we're giving a 5 or 10 day course, in the management of a UTI. Definitely not something I'm probably going to worry about in the long term, folic acid deficiency. But if you've got somebody on UTI prophylaxis or prophylaxis for another purpose, some of the HIV conditions and opportunistic infections can be managed with sulfamethoxazole /trimethoprim. So again, if you see this medication on board chronically, definitely might be a good idea to take a look at that folic acid level and make sure we're not getting deficient there. Sulfasalazine, another drug potentially used in GI disorders, potentially used in autoimmune disorders like rheumatoid arthritis. So that's another one to kind of think about there. Triamterene, so this is a potassium-sparing diuretic, has had some associations with folic acid deficiency. And of course, if you know your patient is a heavy alcohol user, that certainly can lend towards the risk of folic acid deficiency. As far as folic acid causing a bunch of drug interactions and impacting other medications, I really don't think of it too much as doing that. I think of other meds causing folic acid deficiency more so. However, there is some theoretical risks in that folic acid could lower phenytoin concentrations, phenobarbital concentrations. So again, it's something that, if you have a patient with chronic seizures, they're pretty stable, things like that, and they've been on folic acid for forever, and we've had levels since that folic acid has been on board. Probably not something I'm going to really worry about strongly. Now, if you're starting folic acid in a patient that's taking phenytoin, for example, it might not be a bad idea to get potentially another free level or whatever levels you're monitoring, and keep tabs and make sure that we're not increasing the risk of seizures there. Again, not an incredibly strong interaction by any means, at least in my opinion, but it is something to think about in a patient that's maybe had very sensitive levels and or had risks with phenytoin adjustments in the past, or at increased risk for seizure for some reason there. So again, I don't place a ton of stock in it, but it is something to think about as we're guiding or changing medication therapy. All right, well, I think that's going to wrap up the podcast for today. I hope you enjoyed this episode, picked up a few practice pearls. Definitely leave a rating review on iTunes if you haven't done so. I'm greatly appreciative to those of you who have done that already. Also share us with a friend, colleague, student group, whoever might benefit from some more pharmacology education. Go check out reallifepharmacology.com, snag that free PDF. Also, definitely support the sponsor, meded101.com/store. I'm going to sign off for today. Thank you all for listening, and I hope you have a great rest of your day.
It is Ryan here, and I have a question for you. What do you do when you win? Like, are you a fist pumper, a woohooer, a hand clapper, a high fiver? I kind of like the high five, but if you want to hone in on those winning moves, check out Chumba Casino. At ChumbaCasino.com, choose from hundreds of social casino-style games for your chance to redeem serious cash prizes. There are new game releases weekly, plus free daily bonuses. So don't wait. Start having the most fun ever at ChumbaCasino.com.
No purchase necessary. VGW Group. Void where prohibited by law. See terms and conditions. 18+.